Hey everybody, it's Dr. Newton from 1981 MD, and let's talk about weight loss injections today. So, these injections have become very popular as a tool to help people lose weight. And I want to state up front that this is not a one size fits all solution, but for some people, it can be very helpful in losing weight and putting chronic diseases such as diabetes and high blood pressure in remission. So I'm going to give you a brief overview today of how these medications work and how you can obtain a prescription. Now, these injections belong to a class of medications called GLP-1 receptor agonists. You know them by the names of Wegovy, Saxenda, and Zepbound. Now, in order for us to understand how these medications work, we must first understand what GLP-1 is and what it does. So, GLP-1 is a hormone that is released by the gut in response to eating of carbohydrates. So, it was discovered in the 1970s along with another gut hormone called GIP. And when these two hormones are released by the intestinal cells, they produce the incretin effect. Now, GLP-1 causes a rise in insulin secretion. So, what happens is you eat a meal, your gut receives a signal telling you that carbs are on the way, and then your gut releases GLP-1 and GIP hormones, which causes your pancreas to release insulin. Now, insulin is a master hormone with many different functions in the body. But in terms of your glucose metabolism, it opens up the cells and allows movement of glucose out of your blood vessels and into your cells where it is then used for energy. So, insulin is the key that opens up the cell so that they can receive glucose. And this is just a picture that is showing the process of when you eat and what happens to the glucose in your system with the help of insulin. Now, as we age, somewhere along the way, our metabolism can become dysfunctional and we end up developing insulin resistance. And what that means is that the cells no longer allow glucose to enter the cell. And what are some possible reasons that you may become insulin resistant? It may be due to poor sleep or a high carb diet. You might have some deficiencies in vitamins and minerals. It might be due to a lack of physical activity, or there's some type of dysfunction in the mitochondria, which is the powerhouse of the cell and where you actually make energy. Now, insulin resistance can cause several different types of chronic medical conditions, such as fatty liver disease, PCOS, heart disease, and obesity. So, back to our weight loss injections and how they work. They are called GLP-1 receptor agonists because they stimulate the GLP-1 hormone receptors. Now, our natural GLP-1 that our body makes only lasts about 5 to 7 minutes. So it's very short acting. And so what these injections do is that they prolong the action of GLP-1. Now, although GLP-1 receptor agonists or the injections are just now becoming popular to the general public, they have actually been around for quite some time. So the very first one was Byetta, and that was FDA approved in 2005. So these medications have been around for about 20 years or so. For an example, semaglutide, which we know as Wegovy or Ozempic, has been around since about 2017. So these are not new medications. They have been around for some time. I know that some people tend to be afraid of them because they feel like they're new, but they actually are not. All right, so now let's talk about how the GLP-1 weight injections actually work in the body to help you decrease your weight. And so they are going to turn down your appetite and your thirst in your brain, and they are going to slow down the movement of food through your gut so that you feel full longer and you don't eat as much. Now, the names of the injections can differ based on why you are prescribing them, but there are only three medications that exist in this area here. So it's going to be liraglutide, semaglutide, or tirzepatide. Now, when you prescribe tirzepatide for weight loss, it is called Zepbound. When you prescribe it for diabetes, it's called Mounjaro. And so you'll see the examples of the names for semaglutide and liraglutide listed here as well. And liraglutide is a daily injection, and the other two are weekly injections. So when you think about which one to choose, you want to consider your weight loss goal and how much weight you are desiring to lose. So with the liraglutide, you can lose up to 10%. So let's say, for an example, you weigh 200 pounds. That means you could lose up to 20 pounds on the medication. And in that same example, if you take Wegovy, then you could lose up to 34 pounds. And with Zepbound, you could lose up to 42 pounds. So because it mainly works in your GI system, that's where a lot of your side effects are going to come from. The main ones that I see are usually going to be either nausea or constipation. Now, the nausea can go away over time, but there's a small subset of people where the nausea will increase as they increase the dose. And so when you get up into the higher dosages, you may or may not notice that you have more nausea than you did when you were on a lower dose. So you could either back down on your dose, or you can ask your physician for a prescription for Zofran. Now, the constipation, if it happens, is the one that tends to linger, and you can mitigate that by taking Miralax every day to help you have a bowel movement. Some of the other side effects that I've heard of from other patients, some of them tell me that they notice that they have a little bit of fatigue. It will usually go away, but sometimes when you get into the higher dosages, you may notice it a little bit more. I've had people tell me that they notice their acid reflux kind of flared up. And every now and then, somebody will tell me that they have had some diarrhea, but this one tends to be the rare one out of the group of common side effects in my experience. So when you go to the website of these injections, they talk about the more serious but rare side effects. And so with gastroparesis and small bowel obstruction, what will happen is that you'll have nausea, have some belly pain, have some vomiting, may not be able to have a bowel movement, even though you're using the Miralax. If these things happen, you need to stop the medication and be seen in person for an examination, labs, some imaging, and your doctor will come up with a plan about what the next steps should be. But if you experience those things, don't continue to take the medicine. Go ahead and stop. Now, the other rare but more serious side effects include pancreatitis, gallbladder issues. If you have active issues in those organs, then you need to talk to your clinician about this before you start the medication. Gallbladder surgery does not mean that you cannot be on the medicine, so that would be fine to take in that instance. Kidney issues, these are going to be in people who already have some type of issue with their kidney, usually people with chronic kidney disease. anytime you take a new medication, you can have an allergic reaction. Heart palpitations could happen. I think that's happened in maybe one or two patients that I've seen, and we just decreased their dose and they were able to continue. If you have a history of type 2 diabetes, then there is a possibility that you might have some issues with your vision. So that's something that you'll want to monitor. Doesn't happen in the general public, but this is mostly in persons who already have type 2 diabetes. They do talk about suicidal ideations on the website. Knock on wood, I've never had anybody tell me that their mood changed, but it is a rare possibility. And if you are going to have surgery, make sure you let your surgeon know that you are on the medication, because when you're under anesthesia, it has now been shown that there might be a possibility that you may aspirate during the surgery, which is something that you don't want. And so you need to let your surgeon know so that they can tell you when to stop the medication, how many days or weeks before the surgery, and then they'll let you know when you can resume the medication after your surgery. So you do not want to use these weight loss injections if you are currently pregnant or looking to get pregnant within the next 2 months. Do not use if you are currently breastfeeding. We don't have any data on if the medication passes through the breast milk or not. So that's why you don't want to use it. Also, don't want to use it if you have a personal or family history of medullary thyroid cancer, if you have a personal history of multiple endocrine neoplasia syndrome type 2, or if you have a active eating disorder. Now, how are the weight loss injections dosed? When it comes to Saxenda, you're going to stay on one dose daily, because this is a daily injection, for 1 week, and then you increase the dose every week until you get up to 3 milligrams. And from that point on, you will take 3 milligrams daily. Now, with the Wegovy, this is a weekly injection. And so you inject weekly, you stay on the same dose for a minimum of 4 weeks, and then you can move up in dose. Now, I have some people, they want to go all the way up to the highest dose that exists. And as long as you are not having side effects, then you could do so. But there are some people that want to stay on the lowest, most effective dose, and you can do that as well. And so, what you're looking for is that you are losing 1 to 2 pounds per week on the scale. If you are losing anything more than that, that kind of puts you in a higher risk category for having side effects and for muscle loss and possible hair loss if you are not getting in the correct amount of protein and nutrients. So a 1 to 2 pound weight loss per week is the goal. If you have a bioimpedance scale and you are able to track your body fat percentage, then you want to make sure that your body fat percentage is actually decreasing. There are some people where the general scale will not move, but when they check their body fat percentage, it's actually coming down. And so those are the things that you want to monitor: your total body weight on the scale, 1 to 2 pounds per week, or your body fat percentage. So with Zepbound, this is a weekly injection. It works similar to Wegovy. The dosages are different, but it's the same concept. So inject weekly, stay on the dose for a minimum of 4 weeks, and then you can move up. So how do you go about obtaining a weight loss injection prescription? So these prescriptions are a little bit more complicated in how you get access to them. They're not like regular medications where your doctor sends in the prescription and you go and pick it up the same day or the next day. There's a little bit more involved in that process. So let's go through it. So the very first thing you need to do before you go schedule a visit with your doctor is you need to check your BMI, because the insurance companies will require you to have either a BMI of 30 and above or you need to have a BMI between 27 to 29 plus some type of weight-related medical condition. I put some examples of weight-related medical conditions on the screen here. But if you fall in between that 27 to 29 category and you don't have any weight-related medical conditions, then your insurance will not cover the cost of the weight loss injections. So check your BMI first before you see your doctor to make sure that you meet these criteria. If you do not, then that means you would have to pay out of pocket for the weight loss injections. If you do, then the next step is for you to check your health insurance coverage plan. So the names that you want to look up of the drugs on the plan would be Zepbound, Wegovy, or Saxenda. Now, there are some times when a patient will come to me and they will say, well, those aren't covered, but I do see Mounjaro or I see Ozempic that are covered by my insurance. Can you send a prescription for that? The answer is, if you have type 2 diabetes, then yes, I can send it because that means your insurance will cover it. But if you don't have type 2 diabetes, then your insurance will not cover the Mounjaro or the Ozempic. So those will not be an option for you unless you decide to pay out of pocket. So you must have type 2 diabetes in order for your insurance to cover Mounjaro or Ozempic. If you don't have type 2 diabetes, then your options are going to be the Zepbound, Wegovy, or Saxenda. If they're not listed as being covered by your plan, then that means you're going to have to pay out of pocket for the medication. Now, if you meet the BMI criteria, and you know that your insurance will possibly cover it, or you've decided that you're going to pay out of pocket because your insurance won't cover it, now is the time that you schedule a visit and see your doctor so that you can ask for a prescription. Now, I do want to add that sometimes the insurance, even though it may say on your plan that they will cover it, they may require an additional step, which is a prior authorization. And so a prior authorization is just extra information that your doctor has to send off to the insurance company for them to make the decision if they will actually cover the cost of the medication. And so generally what happens is that your doctor will send the prescription to the pharmacy. Pharmacy runs the medication through your insurance. They see that you need a prior authorization. The pharmacist will send the prior authorization back to your doctor. Then your doctor will have to complete that extra information and send it back to the insurance company. And the insurance company will either decide to approve or deny coverage of the medication. Now, what kind of things are the insurance looking for? They want to know what your diet is like, what your physical activity is like. They want to know if you have been on previous weight loss medications in the past. Very specific. They want to know timelines, and they want to know how many minutes you work out per week. They want to know how many calories you're on, those type of things. So make sure that you kind of have that type of information in mind when you go see your doctor, because that's what they're going to ask on the prior authorization. So once your insurance gets that information, they'll make a decision. If they approve the coverage of the medication, then you can go to the pharmacy and pick the medication up. If they deny it, they will usually send you a denial letter and they will state the reason as to why they deny it. Some of the common reasons is that they don't cover it at all, or they want you to be on try a different weight loss medicine first, and if it fails then they might cover the weight loss injections. Sometimes when you fall in that category of the BMI of 27 to 29, you might have one weight-related medical condition, and they may come back and say they want you to have two. So lots of different reasons as to why they may deny it, but they will usually tell you if or tell you why they have denied the medication. So if it's denied, then that means that you will have to pay out of pocket for the medication. So again, if it's approved, you go and pick up your pre-filled single dose pens at your local pharmacy. You'll get 4 a month because if you are taking Zepbound or Wegovy, and then you'll get 30 if it's for the Saxenda. Now, again, if insurance denies it, then you have to pay out of pocket. So what could those possible costs be? So if you want the pre-filled single dose pens, then out of pocket cost is $1,000 and up per month. And if that is, too much or you can't afford it, then your next option is going to be a pre-filled single dose vial. And right now you have access to Zepbound, so you get it directly from the manufacturer. Your doctor can send a prescription to them, and then you'll receive an email or a text to make your payment, and then they will mail the medication to your home. And so these are the prices for the different dosages of the medication. Wegovy has also decided to provide out-of-pocket costs directly from the manufacturer. It's not available just yet, but probably pretty soon you'll be able to get Wegovy. So that would be another option. Depending on when you're hearing the video, it may already be out, and just talk with your doctor about that and go to the Wegovy website to learn what the price is. But in the future, that will be an option. But for right now, it's Zepbound in a single dose vial. So what that means is that you pull all of the medicine out of one vial per week. So you'll throw the vial away after you use it. So it's a single use vial. Now, the third option would be a compounded injection if you felt comfortable using it. Now, these are going to be multi-dose vials. So what that means, you're going to have one vial and you're going to pull medication out of it multiple times. So you will not throw the vial away after one use. You're going to use it multiple times. And the medication is going to be mailed to your home. The price is going to be determined by the pharmacy that your physician uses. So different pharmacies have different prices. And so you would have to ask your doctor how much that would be. Not every doctor prescribes compounded injections. And so that's a question that you need to ask or find out. If they do compounded injection prescriptions. The advantage of the compounded injections is that it will allow for you to adjust the dose. So let's say I have somebody on tirzepatide at the lowest dose of 2.5. They're having some nausea and they are actually losing weight, but the nausea is bothersome. With the injections, then you could decrease the dose a little bit below the 2.5. So that you can still get the benefit of the weight loss, but not have the nausea. So you can kind of do some dose adjustments, whereas you cannot do that with option number 1 and option number 2. Now, some states do not allow the prescription of compounded injections. Mississippi is an example of that. So it's important to know your state laws and know if you can gain access to prescription compounded injections. So that was information on just the general outline of how you gain a prescription for a weight loss injection from any physician. However, if you would like to see 1981 MD for a prescription, then let's talk really quickly about the process. So the first thing to do is complete a weight intake form. It is located on the weight loss page of our website. If you have access to our scheduler and you're not on our website, once you schedule the visit, you will receive an email, and in that email, it will have the weight intake form. So if you haven't already done it, you'll have the opportunity to do so at that time. Please make sure that you do the intake form before your visit, because that will help us in the time of our visit so that I won't have to obtain all of that information, because I really want to get down to giving you some extra information to help you with your weight loss goal outside of the weight loss injection. And so if I have to ask all of the questions on the intake form, it's going to eat up your visit time. Now, for the labs, I do want to make sure that your liver and kidney are okay. That's the bare minimum. And you can upload labs from your primary care doctor's office into the intake form. So you will have that opportunity. If you have not had labs done 2, 3 years, or you don't have access to your labs from your primary care physician's office, then you can get a lab order sheet from us. We'll email that to you, and you can take it to a lab of your choice that is near you. Now, bare minimum is what we call a comprehensive metabolic panel, or CMP, and that's going to tell me about your liver and your kidney. Ideally, I would like to look at other things. So I want to look at your iron, your vitamin B12, your vitamin D. I want to know, do you have prediabetes? Do you have type 2 diabetes? Are you insulin resistant? I want to look at your thyroid and some other things. And so these are the ideal labs that I would like to have on you. A lot of times these things are usually going to be done during your annual at your primary care office. And so you will again have the ability to upload your labs into the intake form. Sometimes people want to add on additional labs that they're interested in having. And if that is the case, then we can order those labs as well. That's something that we can discuss during the visit. So let's talk about how the insurance labs are billed. So most people will decide to bill the labs to their insurance. And so the way that it works is that the lab company determines the price, and then they send the bill directly to your insurance. And so what that means is that 1981 MD is not involved in the billing process whatsoever. I order the labs, but I do not have any say so in the price of the labs. And so your insurance will determine if they will pay in full, pay a partial amount, or not pay at all for your labs. So any remaining balance that is due will have to be paid directly to the lab company. So because the lab is determining the price, we unfortunately are unable to give you a estimate of how much your labs will cost. What some people tell me they do is when they get to the lab, they'll ask the lab at the front desk what the quote will be, and then they determine if they will move forward with the labs or not. Now, there are some people who have already had an experience or multiple experiences with their insurance, and they know that they won't pay for the labs in full, and they will have a balance. And there are some people who just don't have insurance at all. So if you fall into those two categories and you want to pay out of pocket for your labs, then I can give you a quote, because your labs will be ordered through LabCorp electronically, and they do have a $10 lab draw fee that's added to the cost of the labs, but the prices tend to be very reasonable. And so for people who want to self-pay, then you do have that option, and I can give you a quote. So for the visits, Just for transparency's sake, 1981 MD does not bill insurance for anything, not for labs and not for visits. And so the out-of-pocket price for the visit is $93. That will include your initial visit and the lab evaluation. All subsequent follow-up visits are time-based, so $62 for 30 minutes and $31 for 15-minute visits. Additionally, you must be physically located in Alabama, Mississippi, Florida, or Tennessee at the time of your visits. If you are not located in those states, then I will not be able to give you a prescription for the weight loss injections. Your pharmacy, if you're picking it up from your local pharmacy, must also be located in those states mentioned. For the compounded injections, that works a little bit different, but again, the mailing address must be in the states that are listed. If you have any questions specifically about the price of compounded injections, the self-pay labs, or a different just general question, you can always send me a text at 205-259-7035, or you can email us at info@1981md.com with your questions. There is also a contact form on the weight loss page of the website that you can submit any questions through. So hopefully that was helpful for you. I would love to work with you on your weight loss journey. So give us a text so we can talk. Hope you guys have a good day.